My name is Andres Garcia and I'm a student physical therapist. Today we are going to be discussing gait speed and temperature and how to assess and interpret them. To begin, we will discuss gait speed. The purpose is to measure a patient's functional mobility and speed in a controlled environment. Now, what it is a great tool for is a predictive tool for a decline and increase in a patient's functional mobility. First of all, we are going to set up the environment.
There are several ways we can measure gait speed. For today's purposes, we will be using the 4-meter walk test. The tools you will be needing is a measuring tape, stopwatch, and cones. The first section you will measure is a 2 meters acceleration zone. The second will be the testing zone, which will be 4 meters. You will begin the time as soon as the patient's foot crosses the first cone and end the time as soon as the patient's foot crosses the second cone. The last measurement you will make is a 2-meter deceleration zone.
Before we begin, we want to take some precautions into consideration. We want to make sure the patient has the proper footwear. Another example of proper footwear would be hospital grip socks. Another case we want to keep in mind is if the patient has a non-weight bearing status on either foot. This could cause further injury and possibly cause them to fall as well. Just go whenever you want, all right? Here we go. Ready? And go. Sir! Wait, sir. What are you doing? Sir, what are you doing? The previous clip was a perfect example of how not to assess gait speed. You want to communicate as efficiently as possible with your patient. First of all, you want to let them know where to walk from A to B. Second of all, you want to inform them of the pace to walk. In this case, a perfectly comfortable pace. Third, you want to walk behind the patient so that they don't follow your pace and that they're walking at their own pace. In this next clip, this will be a good example of how you're supposed to do it. What we're going to be doing is we're going to be walking from A to the second cone over there, B, at a very comfortable, normal pace, okay? And when I say start, we will begin. Ready, set, start. Notice the student physical therapist only measures the space between the inner cones. In order to get the most accurate interpretation of the test, you will perform 3 separate trials, and the calculations will be as so. 3 trials in the gait speed. We have the first one, the second, and the third. We need to take the average. So I've done the work prior to this so you can see everything in detail. So the average was 8.7 divided by 3, which was 2.9 seconds. Now, since we used the 4-meter walk test, we actually have to divide 4 meters by the average of the seconds of each trial so that we can get meters per second right here. That is that. And now that we have our value, we're going to compare it to the norms to see if we can interpret it. After completing the assessment and calculation of our patient's values, we can compare them to normative charts of healthy adults. As we can tell, 1.38 falls into the normative value of a 25-year-old healthy male. Now we are going to be assessing and interpreting temperature. A person's body temperature says a lot about their health, so it is important to properly assess a site. 2 commonly used sites are oral, which is sublingual, and this is the most commonly used in everyday practice, or auxiliary, under the armpit, which is most commonly seen in nurseries. The normative values for oral temperature is 98.6 degrees Fahrenheit. For auxiliary, it is 97.6 degrees Fahrenheit. This is important because if the value of temperature is above the normative value, then the person could possibly have a fever, which is a disease-specific stimuli. We're going to be taking your temperature, so I'm just going to be setting this up for you. All right, cool. Let's just make sure this is working. How are those peanuts treating you?
Good, they're good.
It's working fine. All right, cool.
Before we do that, I'm just going to take a sip out of my coffee.
What? Oh, yeah, cool.
That's fine?
Yeah.
It's hot.
I was going to change it out, but we're guys, right?
That's fine.
All right, ready, sir?
All right.
Open up your mouth and just take that. Perfect, dude. The previous clip is a perfect example of how not to assess body temperature. You want to keep several precautions in mind. First of all, 20 to 30 minutes prior to assessing oral temperature, you don't want the patient to consume anything hot or cold because it could yield an inaccurate value. Second, you don't want the patient to exercise before assessing temperature because it could increase the value. Third, you want to inform the patient to place the thermometer under the tongue and not to bite onto the thermometer, because it could damage the equipment, and if it's a glass thermometer, it could injure the patient. This next clip is a great example of how to assess body temperature. We're going to be assessing your temperature. So first of all, I just want to ask you, have you eaten or drinking anything cold or hot in the past 20 to 30 minutes?
Nope.
All right, perfect. All right, so I'm just going to get you a fresh tube here, which makes it nice and sterile for you. All right, so if you could please open your mouth, and I'm just going to place this right under your tongue, okay? And then you can, don't bite on it, and just slowly, we'll see what your temperature is. Oh, would you look at that? 98.3. Perfect score. Now that we have demonstrated how to assess and interpret gait speed and body temperature, I hope that you can not only apply this to your education, but to your life as well. Thank you for watching.